Sleep Disorders and Epilepsy by Alexia Buis. For this presentation, I would like to focus on two things. First, I would like to discuss the relationship between sleep disorders, specifically sleep apnea, and epilepsy. Second, I will discuss how people with epilepsy and obstructive sleep apnea have increased excessive daytime sleepiness. I will also discuss how treating obstructive sleep apnea in patients with epilepsy can improve seizure control. Before I get into the meat of this presentation, let's take a quick step back and cover some basics. I want to make clear what both sleep apnea and epilepsy are. Obstructive sleep apnea, OSA, is a sleep disorder where breathing is interrupted repeatedly during sleep. The pauses, or interruptions rather, last at least 10 seconds long. This happens when the muscles in the back of the throat fail to keep the airways open. It can lead to hypertension, heart disease, and mood and memory problems. Epilepsy is a neurological disorder involving recurrent seizures. A seizure is caused by increased electrical activity in the brain and can cause violent body shakes or a simple staring spell, known as an aura. Okay, now let's fast forward back to where we were, the relationship between sleep apnea and epilepsy. As said by the Sleep Foundation, for people with epilepsy, sleep problems are a double-edged sword. Epilepsy disturbs sleep, and sleep deprivation aggravates epilepsy. Sleep activates the electrical charges in the brain that result in seizures, and seizures are timed according to the sleep-wake cycle. Needless to say, the two are clearly related. So much so, in fact, people with epilepsy are more prone to also having obstructive sleep apnea. People with epilepsy have increased excessive daytime sleepiness, EDS, caused by seizures in sleep, and sleep disorders are increased in people with epilepsy. A study entitled Excessive Sleepiness and Sleep Patterns in Patients with Epilepsy, a case control study, assesses sleep quality and symptoms of OSA in people with epilepsy and evaluate the association with seizure frequency and AEDs, anti-epileptic drugs. 150 adults with epilepsy, both male and female, and all above the age of 18, were used in this study. The participants were given 3 different questionnaires. PSQI, Pittsburgh Sleep Quality Index, evaluating sleep quality over the previous month. SSS, Stanford Sleepiness Scale, assesses how alert you are feeling. And FLAQ, Fletcher and Luckett Adapted Questionnaire, which is a neurological examination. The data from these questionnaires was then compiled with a control group. Seizure data was used from medical records from the previous 12 months. The ESS, Epworth Sleepiness Scale, questionnaire was also used to find out daytime sleepiness. Overall, the study showed people with epilepsy had increased SSS, increased ESS, and increased EDS in comparison to the control group. Because sleep apnea and epilepsy are related, there have been studies to show that treating obstructive sleep apnea in patients with epilepsy can improve seizure control. A study entitled Effect of Positive Airway Pressure Therapy on Seizure Control in Patient with Epilepsy and Obstructive Sleep Apnea delves into a treatment option for OSA. Positive airway pressure, PAP therapy, appears to produce beneficial effects on seizures in adult patients with epilepsy and OSA. In this study, seizure outcomes are compared between adults with epilepsy, with PAP-treated OSA, with untreated OSA, and without OSA. Participants of this study are all over the age of 18, are diagnosed as epileptic, and have documented seizure data. After many tests, apnea was defined as a greater than or equal to 90% decrement in airflow for 10 or more seconds. The ESS, Epworth Sleepiness Scale questionnaire, was filled out by all participants. The participants then had overnight PAP therapy over a 6-month period. Seizure frequency was measured, and the primary outcome for participants was greater than or equal to 50% seizure reduction. Out of 132 subjects, 56 did not have OSA. 76 had OSA. Out of these 76, 43 were on PAP therapy. 83% of the 43 on PAP therapy had greater than or equal to 50% reduction of seizures. In conclusion, This study shows PAP therapy improves seizure control in people with epilepsy. Also, it eliminates respiratory events, arousals, and oxygen desaturation. It also decreases daytime sleepiness, depressed mood, and blood pressure. After looking at this study, it is clear that treating OSA in people with epilepsy can improve seizure control.